In Bangladesh, more than a dozen health workers have been arrested on charges of selling thousands of fake certificates claiming people are free of the disease. Corruption has only added to the challenge of fighting the COVID-19 outbreak. Tanvir Chowdhury has more from Dhaka.
Bangladesh has increased the number of hospitals to treat COVID-19. But despite the infections rising, more than 2/3 of the hospital beds are lying empty, with people worried about the quality of treatment they would receive. The government turned to the private sector to boost healthcare capacity, but many private hospitals where COVID-19 cases are being treated do not have adequate monitoring and supervision. Saiful Islam brought his father to a private hospital in the capital for treatment. He was dismayed by what he found.
I
took my father there thinking things will be better because it's a private hospital. But once admitted, we found the conditions were bad. Most staff didn't even have any protective gear. The hygienic condition was very poor. They not only misdiagnosed my father, but also charged us an exorbitant fee.
Hospitals have been found to be operating without proper licenses, labs providing fake test results, and pharmacists selling expired medicine. In May this year, 5 patients died in a blaze at a private hospital in Dhaka. Fire department reported it violated safety standard, and some senior officials have been charged with negligence.
My father-in-law died due to the gross negligence of the United Hospital. He was a corona negative patient, yet they kept him in the isolation corona ward located outside. Even though he died because of the fire incident at the hospital, they presented us with a bill of $1,785 the next day, saying you will get the medical reports after the payments are made.
In another high-profile case, a private hospital owner and a government doctor were arrested over their alleged involvement in a COVID-19 testing scam. Regent Hospital administrators signed an agreement with the government in March to turn it into a dedicated coronavirus hospital. Law enforcement agencies raided the care center last week and sealed it off. Some healthcare workers are charged with issuing fake COVID-19 certificates and illegally demanding money from patients. Bangladesh's health ministry didn't respond to Al Jazeera's request for an interview. A recent Transparency International Bangladesh study revealed many healthcare facilities in the country are being operated without following government regulations.
Well, corruption in the health sector in Bangladesh is deep and wide, like any other most of the sectors. But in this case, it is more prominent, and what we hear and see and find from various reports, which are very, very credible.
Exposing corruption is becoming a challenge in Bangladesh. In recent months, many journalists, academics and doctors who spoke out about mismanagement in the health sector were detained by authorities under a digital security law. Critics say there is a growing climate of fear that will only impede the fight against coronavirus. Tanvir Chowdhury, Al Jazeera, Dhaka, Bangladesh.